Think we'll get rolling. There will be a few other people that join us, but I don't want to penalize anybody who's here and on time and ready to hear all about seasonal affective disorder. So to welcome everybody, my name is Kristen Cook. I am with MercyCare Business Health Solutions. I manage the wellness division here at Mercy, and I'm pleased to collaborate with our Mercy EAP department. So we're doing more and more collaborations in hopes that we're providing you with good, valuable resources. Hopefully most of them remain free and available to the broad scope of anybody who's interested in hearing the message. So with that, I'd like you to get to know Mallory Markwitz. She, again, like I said, is with Mercy Family Counseling here at Mercy. She's been with Mercy for 6 years and is a licensed social worker. So we'll get started here. And if you have questions along the way, please add those to the chat feature. And we will get those questions that you have covered at the end of the presentation. So thank you again for joining, and I will now turn it over to Mallory.
Hi, everybody. So I was just giggling a little bit earlier. I have a bad cold, so forgive me if I sound a little hoarse. But thank you for having me. Happy to join with you all. So like Kristen said, if you have any questions or anything during or after, please don't hesitate to reach out and ask away. We want to make sure that there's time for that. And I'll talk for a little bit. I have a few slides, and then we'll leave time for questions and comments and things afterwards. So welcome, and we will be talking today about seasonal affective disorder. So really kind of giving an overview of what it is, the diagnostic piece, some treatment options, and what you may see just in general terms of what others might be struggling with around this time of year. So seasonal affective disorder, and I'll label it throughout here as SAD. It's a type of depression, so that's related to changes specifically in the seasons. So I know a lot of times people think depression, I mean, it's different, right? So the depression is the actual diagnosis, but seasonal affective disorder is kind of an umbrella underneath that. So it typically begins and ends around the same time each year. For most people, we usually see this in the winter months, right? So just a natural kind of deterioration in mood and overall wellness. They call that winter pattern seasonal affective. So something that a lot of people don't know about it is that there's actually summer pattern seasonal affective as well. So much less common than the winter pattern, but it is out there and it is something that's prevalent. So just some signs, general signs and symptoms of this and what kind of to look out for. Like I said before, this is not considered a separate disorder. So it is a type of depression. So a lot of the signs and symptoms that you will see in this, or if you're experiencing these, look a lot like depression. Symptoms typically last about 4 to 5 months a year. And not every person will experience all of these symptoms listed below. So if any of you are familiar with or have struggled with depression, the list down there of symptoms really is pretty close to a depressive episode. So, you know, like I said, the symptoms that we're looking at in seasonal affective are lasting several months in a year. They will differ from winter pattern to summer pattern and what that looks like. And not every person who is diagnosed with seasonal affective will experience all of those symptoms, and they may not experience them every year. It may look a little bit different from year to year. So the symptoms, like you can see there, feeling depressed most of the day, nearly every day, losing interest or activities and things you may have enjoyed previously, struggles with sleep, energy, feeling hopeless, even thoughts of suicide or self-harm. So some things to look out for and pay attention to. Additional specific symptoms. So like I mentioned before, they differ a little bit between winter and summer pattern. So when you're looking at winter pattern, I think we all kind of tend to think of like that hibernation mode, right? So a little bit of oversleeping, so feeling kind of lethargic, tired, low energy throughout the day. Overeating, particularly with carbohydrates. So weight gain comes along with that. And again, that social withdrawal. So we kind of all go into hibernation mode, which I think has been a little bit more extreme the last few years just because of the pandemic and everything. Some of that social isolation has really ramped up a little bit there. So, and then on the other end, summer pattern. So some of this is kind of the opposite, right? So there is still some anxiety or irritability, but looking at more of an insomnia, so trouble sleeping, poor appetite, some weight loss, agitation, those kind of things. So again, it can differ. Those symptoms can certainly combine with each other, but it looks a little bit different when you're looking at winter versus summer. So looking at who may develop seasonal affective disorder, honestly, a lot of people may suffer with it and they don't even know it, or they may feel like something's going on, but they don't have a name to put to it. Typically, it occurs more often in women than in men, and for obvious reasons, more common in those living further north. So when the daylight hours are naturally shorter in the winter months, we experience this obviously more than some of the folks in the south do. Not that that's not prevalent. So more common in people with major depression, major depressive disorder, or bipolar disorder. Like I said previously, this is a type of depression, so that makes sense that those who already experience some of those depressive disorders would have a more commonality in terms of and then to go along with that, people with seasonal affective tend to have other mental health disorders. It's not, uncommon to see some other things along with that, anxiety disorders, ADHD, panic disorder, etc. So fairly common to see, not just this as the main disorder, but kind of other underlying things as well. So I loved this picture because I think it really leads into this last few years, and I don't know if anybody else has recognized this, but I talk about this a lot. Just even the last few months, right? We've seen such an up and down shift of this weather. So one day it'll be like today where it's sunny, but very, very cold, and then we had our lovely tornado warning the other week, and then we'll have warmth, and then we'll have cold. So kind of that up and down is really difficult to adjust to. Looking at causes of seasonal affective, in an obvious way, our biological clock, right? So when the weather shifts, we naturally, our bodies shift with that. So any, reduced level of sunlight, fall, winter, may disrupt that internal clock and lead to those feelings of depression. Serotonin levels that's a huge player in this. So serotonin, it's a chemical messenger, it's a neurotransmitter that helps our brain and our nervous system communicate together. So it's general, one of the main functions of serotonin is to stabilize your mood. So those feelings of happiness and well-being are affected by that. So when sunlight is reduced, there can be a natural drop in serotonin for us all. And so that can affect our moods pretty significantly. Melatonin levels, so just kind of like serotonin, the change in season can disrupt the balance of your body's level of melatonin. So that is playing a huge role in your sleep patterns and your moods in general. So if any of you take melatonin to help you go to sleep, it's really, its effect is to cause some drowsiness. So overproduction of melatonin, though, because of that, can cause an increased sleepiness. And so people with seasonal affective disorder may produce too much melatonin, and really, again, that's central for maintaining that sleep-wake cycle. So deficits in vitamin D. So vitamin D is really thought to promote serotonin activity. So if there's deficits in that, it can affect it as well. And then I think the last one here is pretty important as well. Just, I kind of joke around with some people because no one really comes into my office and says, "Oh, I just love winter and I love how it makes me feel, and I just feel so happy in the winter." So most of the time, people just kind of associate winter with this blah feeling, and we love to be outdoors and we love to experience the sunlight and the warmth. And so just really recognizing the general negative thoughts about how we feel about winter and kind of the limitations that it naturally causes for a lot of us. So and then diagnostically, right? So I've said before, for a diagnosis of seasonal affective disorder, you have to have symptoms of major depression or the more specific symptoms listed. So since it's a type of depression, that makes sense. I mentioned this prior, but the episodes have to occur during specific seasons, so that winter or summer months for at least 2 consecutive years. But they don't have to experience them every year. Like I said, it could look different, and that may be also related to kind of some shifts in the weather as well. And the episodes must be much more frequent than other depressive episodes that a person may experience. So with somebody who struggles with depression already, you may see that looking different during the winter or summer months than other depressive episodes that they may experience. So that's just kind of what we look out for in terms of diagnosing seasonal affective disorder. So treatment, there are a lot of different types of treatment. So a lot of you may have heard or seen people using those light boxes, right? So the intention of those, light therapy, that's been something that's been used since the 80s. But people who struggle with that diminished natural sunlight may use or find benefit in some light boxes, or even I've seen with the increase in people working from home, being by a window or being by natural light has helped a lot as well. So typically that light therapy is usually someone sitting in front of that bright light like 30 to 45 minutes a day. It's usually when they're using them, it's about 20 times brighter than ordinary light, but it does filter out some of all the damaging UV light. So when you're exposed to it, it's not like you would be harming yourself. Psychotherapy, CBT, it's cognitive behavioral therapy. So talking about those negative thoughts about winter and kind of how we naturally respond to it, kind of replacing some of those negative thoughts. Behavioral activation I have down here, really, with people struggling with seasonal affective, it's one of those things where I kind of encourage, if you struggle a lot more in the winter months or the summer months, and you recognize that about yourself, kind of being proactive, scheduling some pleasant things to do, or thinking of things indoor or outdoors that you can be doing to kind of combat that lack of interest. Doesn't mean that those symptoms are going to go away totally, but it certainly can help kind of adjust your way of thinking and give you a little bit more of a positive outlook. So medication here. So like I said, since seasonal affective is a type of depression, it's also associated with those disturbances in serotonin. So you'd see like an SSRI, so that's a serotonin reuptake inhibitor, and those are used to treat depression as well. So you may see some, medication related to treating seasonal affective. And then one that's a little bit less popular, but replacing that vitamin D deficiency, if that's something that someone's struggling with. It may help improve symptoms, but typically a mixture of all of these things, or a mixture of treatments, help best. So and I wanted to add on here too, I think kind of looking at just in general things that may show up when we're looking at our coworkers or working together as our team, just kind of recognizing some things that may be triggers to seek help or to try to help a coworker or help yourself. So kind of looking at a lot of them are similar to, what we're talking about with seasonal affective, but really noticing kind of a shift in behavior in other people. So when we're working closely with people, if you're in a leadership role, if you're just a coworker concerned about someone else and you see some of these things, really recognizing that, especially over the last few years, it's really ramped up. So really kind of knowing and having the knowledge about the symptoms and what to look out for can really help sometimes when you're trying to provide support to somebody. So in a lot of these, we may experience off and on, and you may see that with seasonal affective disorder. You may see that with other depression, anxiety, or life stressors. But, paying attention to kind of sudden changes in behavior for a lot of people. So, if someone's not focused or they're not motivated like they typically are, irritable or kind of snippy with people, and they typically aren't like that, missing work or kind of just being withdrawn when they're at work. Those can be some things to look out for as well. So obviously this list isn't exhaustive, but it's just some things to kind of pay attention to when we're working with each other as well. And, along with those, the negative kind of effects, what does that look like again when we're looking at people we work with or coworkers, or again, if I know a lot of you are in leadership roles, so paying attention to your employees and kind of how do you support them. I think performance and productivity is huge, and we've seen that shift a lot in the last few years, I think. So just looking at depression in general, interferes with a person's ability to complete job tasks about 20% of the time, right? So that's pretty significant when you're trying to, care for people, or you're engaged in, day-to-day tasks. A lot of people will miss work, or they will get less work done. So presenteeism is what they call it. So being present at work, but not really being present, right? So mentally or emotionally not really engaged like you typically would be. Kind of like I said before, that lack of concentration, looking for difficulty handling time pressures or multiple tasks. And again, that the last few years, really, we've seen that increase in burnout, and kind of looking at that in terms of how does that affect our productivity or our performance? Are we putting others at risk? Are we putting ourselves at risk if we're struggling with some of these things? So in terms of engagement, kind of things to be aware of. Depression reduces cognitive performance, so 35% of the time, which is even more significant than that physical piece, right? So, and I think that's kind of what we're seeing a lot of, just how we interact with each other, and our ability to show empathy, and our ability to be patient and show respect and be, on at work all of the time. So sometimes that can lead to burnout as well. So I have on there contagion effect. So this kind of contagiousness of the burnout and kind of feeling blah, and just everyone dealing with their own stressors and things that have happened, I think has really increased over the last few years. So and then just a few other things, kind of looking at I mentioned the physical capability in your daily functioning. But also trouble receiving negative feedback or responding to change in general. Change is hard for us all, but kind of noticing that increase overall for people. I think this last few years especially has been difficult. So just some things to look out for. And how do we support each other? How do we accommodate these things when maybe you recognize that someone's struggling, someone in your personal life that's struggling. How do you help them? How do you support them? And be a resource, be a positive resource for them. So like I said earlier, if you're a leader, leaders play a huge role, I think, in where stress can be reduced or managed. So kind of looking at the symptoms, of these things and recognition of that, being aware I think is key, because especially leaders have, the ability to kind of shift some things that they can, or notice that someone's struggling and offer support or resources that maybe coworkers might not be able to. Be vulnerable. So that's been a huge one, I think. It's been a little bit forced the last few years, which is fine, because it's normalized some of these challenges that people have experienced, and kind of recognizing that the losses and the things that we've struggled with in the last few years. So we're all kind of feeling some sort of discomfort. So sometimes, being honest, opening the door for honest conversations and having people feel comfortable with coming to you with those things can be helpful. And then validating, right? So, active listening, normalizing the need for help if someone needs help, encouraging people to, help themselves, to take care of themselves, reassuring that they're not alone. That could be pretty significant for people when you're trying to support somebody. So, and again, this isn't exhaustive. There's tons of things, but just some things to kind of keep in mind when you're working with others. So I want to open it up. I know kind of went through that a little bit quickly, but if we have questions or comments, or maybe some things that you've seen in your work environments, feel free to open that up, and I'd be happy to answer things or talk through some things.
I don't have anything in the chat right now, but I'll give everybody a little bit of time.
Sure.
But Mallory, maybe a question. You said be vulnerable, be open. What are maybe some of the key terms to either use or not use when you're trying to open a conversation and just don't know how to do that?
Yeah, no, that's a good question. I think that's been something too that a lot of people struggle with, because I call it I don't want to poke the bear, right? I don't want to disrupt someone if they're already struggling, and I don't want to open a door if they don't want it open. I think when you're working in your work environments, especially, you know each other fairly well, or you get to know each other fairly well. So I think recognizing maybe when things are off or someone's behaving in a different way can be helpful, and really just approaching it with empathy. I think a lot of times we can ask the question but go roundabout and say, hey, I've noticed you've just been a little bit more quiet, or is everything okay? It seems like maybe you're off, or you're having a hard day. Or even sharing like, gosh, today was really just stressful for me, or overwhelming. Like, have you ever had days like that? So kind of in a roundabout way of, I want to support you, but I don't want to ask too much or kind of invade your space. And I think a lot of times people just like knowing that someone sees or cares. I found that, typically in the work environment, right, I'm not looking for somebody to fix whatever's going on, or to, take care of it for me, but really just having that support, or having someone say, hey, are you okay? Or do you want to, do you need to take a break? Or do you want to talk about something? Can sometimes open the door for some good conversations. Is that going to help?
Absolutely.
Good.
There is a question. Will you be able to share your slide deck, please?
Sure. Yeah, absolutely. I don't know how. Can you send that out, Kristen, or?
Yes.
Okay. Yep.
We can get
Absolutely.
that out to everybody. Thank you for the question. I'm going to ask another one because I'm actually a little bit interested truly in this whole topic. But if you have, say, seasonal affective depression 1 year, is it automatically going to happen next year? Because I feel like maybe I have a little of this, but it wasn't bad last year, and maybe this year it is. So
that's kind of the difficult piece of this, because, and I think really, even that's why I brought up this last year, because I think the weather that's shifted so frequently has been a really big disruption for a lot of people. And so I think, myself included, recognizing, wow, so 3 days ago it was sunny and warmer and I could walk outside and enjoy it. And then today it's freezing and, well, it's not cloudy, but, kind of recognizing that those things are natural shifts and our body is going to do that. And so with the weather changes, though, that's really hard to anticipate. So if somebody experienced symptoms last year, they may not experience the same ones this year, because the weather may look different. Or perhaps you're doing more to be proactive about it. And that's kind of reduced the intensity of the symptoms. But yes, to answer your question, you may experience it one year and then the next year it may not necessarily show up the way it does. I think that's really dependent on a lot of those things. But the difference there of, is this seasonal affective? Is this my body's natural reaction? Or is this a more significant depression that comes and goes that's not in the season change? And I think a lot of times people, myself included, it gets confusing to kind of understand the differences between those. I would say if anybody's concerned about any of the symptoms and recognizing that it's happening, whether or not it's seasonally, it's a good thing to bring up to, your family care doctor and just say, hey, is this kind of normal? Is this something that I need to look out for? And even understanding that a lot of this is just natural, that our bodies are gonna respond in that way too. So yeah, it looks different. It looks different for a lot of people. And I also think that if you experience it in the winter, doesn't mean you can't experience it in the summer. It just may look different year to year.
Awesome. Mallory, 2 more questions coming in.
Sure.
Any recommendations for the lights to purchase for the light therapy, and how often to use it to get the effect?
That's a good question. So I haven't really looked into lights. I'm assuming you can get anything on Amazon because you can. I think there's a lot of them on there. I've had a few of my patients look into some and had some good luck there. I think they're fairly inexpensive. The research that I've seen, and I think I mentioned in the earlier slides, usually like 30 to 45 minutes a day. So when we're thinking of kind of the natural sunlight that you would get if it's the summertime or if it's springtime and I'm outdoors, right, I would say probably an hour at least, right, of daytime and sunlight. I think that may shift depending on, are you typically in, an office environment during the day that doesn't have natural light? Are you going outdoors even though it's cold? Are you, kind of looking at your lifestyle personally and what may help you? But I think the general timeline was like 30 to 45 minutes a day.
Thank you, Mallory.
Yeah.
Another question. If you're being treated for depression, how do you know if you are having SAD and not just a change in your depression? For example, should medications be reevaluated even if it's just seasonal?
That's a really good question. So I would say, so everyone experiences depression differently. And so you know yourself best, obviously. In recognizing those changes for you, what does that look like? And I would look at specifically the symptoms of depression, what's different for you, and what does that timeline look like? So what's different and how often? So what does that shift? And if you can kind of, okay, this isn't really seasonal, or maybe it is kind of seasonal. I think either one would be appropriate to reach out to your provider and say, hey, I'm noticing. I always encourage people, if you're noticing things that are different and they're pretty consistent, I would say at least a few weeks at a time, recognizing those in yourself and saying, okay, maybe I'll try some self-care things, or maybe I'll try some anxiety management or stress management, see if that helps them. But if they are fairly consistent and you're noticing that, regardless of if it's seasonal or not, I think approaching that with your provider and saying, hey, I'm just kind of concerned about some of these things I've been noticing. Should I keep an eye on it? Do we think I need a medication adjustment? That kind of thing. Hopefully that helps answer that. It's not uncommon to need a medication adjustment. And a lot of times people are on medications for a long time and they, their bodies develop some resiliency towards that because you're getting your body's just getting used to it and metabolizing it differently. So good things to keep an eye out though for.
Awesome. All right, well, we're creeping up at the end of our time here. Mallory, thank you so much for being our expert today. Appreciate the collaboration.
Sure, absolutely.
For those still with us, if you have ideas for future webinars or topics, please let me know. I'll stick on for an extra few minutes just to see you chat those into the chat box. And then just a quick little, I'm going to call it a shameless plug, but we've got Women on Weights coming out, still a few classes up on our roster. So if Women on Weights sounds interesting to you, check out our website. All the details, all the classes are there. And of course, we know that movement is good for managing depression, anxiety, all those nasty things that come about, especially in the winter. So we'd love to see you. All right. Thanks
so much.
Appreciate your time.
No problem.